Okay, so we're going to have a panel on reimagining public healthcare and personal medicine. And on this panel, we have Neto Ikpeme. He's the CEO of Wella Health. Let's give him a round of applause as he comes to the stage. Is Dr. Neto here? Because I know he's a doctor. Okay, please come to the stage. Clap for him, clap for him, clap for him, clap for him. I see you, bro. Next, we have Ifeoluwa Dare-Johnson. She's the CEO of Healthtracka. Hi, Ife. I can't see beyond these slides, but I see you coming. And then we have Abimbola Adebakin, the CEO of Advantage Health Africa. Congrats. And to moderate this panel, we have Oluwanifemi Kolawole, Senior Reporter at Techpoint Africa. Hi, nice to see you. Please, if you're standing up, sit down. It's not by force, but you will enjoy this panel. Hi, Nifemi. I promise you. Please sit down. Please sit down. Please sit down. I know some people want to get food. The lounge is overcrowded. We're trying to be COVID compliant. There are Lagos State government people here. So there are just a lot of factors at play. But if you can, just sit down for the meanwhile. That place is going to empty out. Maybe in the interim, you can go in and get food and come out. But sit down. I empathize with everybody trying to get into the lounge, but not COVID. All right, we will kick this panel off now. Please give them a round of applause again. Thank you, and pay attention. Does that work?
Good afternoon, everyone. Oluwanifemi Kolawole, Senior Reporter, Techpoint Africa. And I'm very excited to be here today to lead this conversation about health. Health, they say, is wealth, and it's like the thing that encompasses all that has to do with us. And I'm here today with professionals and specialists in that field to talk about what the future of public health care and personal medicine is. You will not agree with me that between 2020 and now, a lot have changed about how we view our health. And that is where we are going to start this afternoon's conversation from, right? We want to look at how the pandemic has changed people's outlook towards health, right? And I'm sure you're going to learn as much as I'm going to here today. So, Neto, I would want to start with you. A lot has changed, but I want it to come from you as a professional. How do you feel people look at health now compared to what it is before 2020?
All right, thank you so much, Nifemi, and a huge pleasure to be here. It's great to see the amount of people that are here today. With regards to healthcare, the pandemic has totally changed the whole landscape. I've been in the space for quite a while, and the amount of progress that has been made in the last 2 years of the pandemic is impressive. And so while, say, the pandemic may not have been great for other businesses and other sectors, in many ways it has been a boon to healthcare and to healthcare companies. And health tech in particular. I'll speak about it from the government's point of view, for instance. I know for a while, myself and a lot of my colleagues, even here, have been working or trying to work with the governments to improve the adoption of health technology. The pandemic essentially forced that. And so with the NCDC, they adopted a lot of technology tools to manage the way they did ran the whole pandemic, because they had no choice, right? They had to, because there were just millions and millions of data points they needed to work with. We also saw the rise of a company like 54Gene. They were on stage earlier speaking about the work that they're doing around technology and leveraging digital as well as genomic technology to improve the way the pandemic was dealt with. So on that side, a lot of progress. On the individual side, I think for a long time, Nigerians were not very interested in healthcare, really. But the pandemic just made sure that it was front and center. And so you have more people just accessing healthcare, being aware that health is really important. So I think it's been a huge boon to the industry, and it will only grow as time goes on.
Thank you very much. You noticed it as much as a lot of us did. And from what you said, I could pick out that more people are aware of the reason they have to stay healthy and keep the people around them healthy. And the conversation around distancing yourself from others came up during that time, which led to more people adopting telemedicine, virtual diagnosis. So I'm directing this to you, Ifeoluwa. How do you feel in your capacity leading a startup that deals with people not having the reason to go to the hospital before they get tested, right? How do you feel in your capacity? You've helped to shape that narrative of people trusting in virtual medicine.
Yeah, thank you so much. Can you help me? Sorry. So thank you so much for that. Can you hear me? Okay, great. I would say that COVID-19 definitely has helped with a lot of, the shift in consumer behavior, right, with health technology and even the outlook towards healthcare, right? So, obviously, before the pandemic, it used to be the traditional way, and even telemedicine companies were struggling to convert people to virtual. But then the pandemic hit, and it became obvious that this is no longer luxury. This had to be a necessity. Right, so it also got to that point where it also became obvious that you can't wait until there is an emergency to visit an hospital. You have to get a bit of insight and control of your health so that you don't, just fall into the mercy of not having a choice, right? Because once you are at the hospital, then the level of choice you have is limited. So our work at Healthtracka is a lot focused on preventive healthcare, and I would have to tell you that it's a lot of health education because we're used to being sick before you go to the doctor, right? Of course, again, we all know these things. What we're doing is just creating the enabling technology that makes it easy for you to take action with your health, right? And I think that we're in early days, but that shift is already beginning to happen. And of course, despite the fact that we don't want to say it, we have the pandemic to thank for that in some way.
Yeah. All right, thank you very much. So I want to call attention to this, that there will be a part of this conversation where you would be allowed as an audience to ask any question you want to be clarified when it comes to public health care and personal medicine as we go on in the conversation. So this I'm taking to you, Abimbola. In your line of work, I've seen how you've been able to man different initiatives from pharmacy to hospital, to a number of hospitals, right? How do you feel solutions that are coming up to help people stay healthy, how do you feel they can also be profitable? Because as it is now, technology is playing a great role, and the health problem is there. So solutions will keep coming up every day. What we got to know was health insurance, right? And then people get their tests in their homes, right? People get consultations over their mobile phones, right? Things are getting beyond what we expect. So how do you feel that solutions like this can also scale while they are helping people promote public health and get them to stay healthy during this period?
Thank you very much, Nifemi. I think one of the ways we need to begin to think as innovators and promoters in health tech is to see things like an ecosystem and know that you are a dot or two dots within an ecosystem. If you think that you have the whole solution for what the challenges are, certainly it doesn't work. Some of us have to be at the forefront, and some have to build the soft infrastructure at the back. If you look at the financial services sector, it wasn't until an InterSwitch came on board that the NIBs woke up to their responsibilities, and then we saw a quick change, a radical change that enabled the operators, or so to speak, the ones at the forefront, like the banks, to then offer us better value. Prior to that, and I speak because I have seen that transition, and many don't even know you've taken a lot of things for granted. Prior to that, we had to take tally numbers and stay, in the bank, or find a friend behind the counter and do all sorts of things that were not, needed. Now you know that at the touch of a button, you can do your transfers at any time of the day. That is where we're taking healthcare to. Right now, it's still at a very nascent stage. So what we are doing at Advantage Health Africa with the multiple initiatives that we're putting out. So we've started with My Medicines, which has showed us that people in any state in Nigeria, any town, any village, can order their medication and we'll get it to them that last mile. But we're saying that that last mile is really a distribution system. And if you work from the fact that what can you do, what can you add to a distribution system, and then you commoditize it or tokenize it, then you are beginning to think about scale. Too many of us are too attached to whether I'm a doctor or I'm a pharmacist. That has to stop. We need to break a lot of our attachments to, those fundamentals and begin to move forward. I'm a healthcare provider. The person coming to me needs a number of solutions. So if I can be a one-stop shop, but create a virtual version of a one-stop shop, maybe then I can dismantle the model, not because I just want to dismantle, but because that's what the client needs. And then begin to use technology to augment the service to that client. So the person is not going to diagnosis, going for medicine, going for consultation, going for therapy. The person knows through you as a channel, as a platform, they can access all of this, and that's where we're heading.
Yes, that is what tech can bring to you, and that is what these specialists are doing. And something just came to my mind right now, that when we're talking about health, if you just look at the people that are here, what we can see are private people, like people that came up with a solution and they decide to make a startup out of it, right? And they're thriving in it. And it comes to my mind, like, who really should you hand your care to? Would you hand your health care to a private person or a government establishment? So which one would you choose? Like, would you rather let a private hospital or a private establishment like this take care of you, or allow a government establishment take care of you? Which one do you go to? Public, anyone? What about private? Would you rather let a private person take care of you? Well, it seems the private have it. And that brings me to the conversation of the future of public health care. There's an issue with capitalism, like we should not hand healthcare and attach it to capitalism because everybody wants to make profits in it, right? So I want us to discuss it right now, like the future of public health. Who should take care of it? Should we leave it to startups and damn the government, or we should just beg the government, please take care of us? Who would want to go?
Thank you so much for that. I think that's very important as our country goes along to really agree on how we're going to deal with the healthcare of the vast majority of us. The reality today is that a lot of healthcare is delivered in the private sector. That's just the reality. And so we cannot ignore that fact. We're a huge country with a growing population, and the private providers do play a big role. Because when you take a step back and even look at the state setup, for instance, Lagos State has put together a health insurance scheme. And when you do the data, when you look at the data and the research that's been published, if Lagos State is able to successfully onboard a significant proportion of the population onto that scheme, they do not have the facilities to actually provide that care. The public simply do not. That's just a matter of fact. And so you're going to insure, say, 10 million people, and you don't have the facilities to look after them. So then what you do is you have to work with people in the private sector. The key thing is how you do it. Myself and Abimbola were this morning speaking of value-based care, right? So the idea that to counter the negative effects of capitalism, where you just want to maximize profit, you have quality measures around the outcomes that you want, and then you pay people according to those, right? And so that really helps to align interest on all sides, so that when care goes to the private sector, it is still value-based and everybody gets value out of it.
Yes, value-based healthcare. So you're talking about a collaboration between the two sectors. Abimbola,
Yes, I want
please.
to add to that. So when you focus on results, there has to be the person who is administering and the person who is checking. Sometimes the public sector or the public organizations or agencies can serve to check, while the private can serve to implement. We need to work hand in hand. Neto has said that the capacity to serve the needs of millions of Nigerians is just lacking. We need to augment that capacity in any way possible. But sometimes some people are worried that healthcare is not a for-profit aspect. So you don't want the capitalist model to come into healthcare. Now, that's a yes or no, it should be a yes and, you must incorporate some elements of capitalism with public health infrastructure.
It's not charity.
It isn't charity, and to expect it to be charity means that you are going to go down that road to lead to poor quality. We want access, we want it at an affordable level, but when we have access and affordability, we want quality. You cannot compromise on paying. I actually hold the position that Africans can pay for quality health care. It's just that we haven't presented it in a manner that they would pay for. They pay for data now. They borrow credit at incredible amounts. They buy all this credit, and MTN and Co. are making huge amounts of money and going with it. It's become a lifestyle. If we want to do public health as we should convert healthcare to be as attractive that you would pay ahead for it as a matter of fact. But we've tried to push health insurance, and it hasn't worked. I think now is the time for us to rethink health insurance models and say, what else can we do? How else can we do it? But whether public sector and private sector should work together, it's a given. We must work together.
Yes, Ifeoluwa, please, let's have you.
Yeah, I really like something that she mentioned, just around how there has to be the implementers and then the people who check, right? And if you look at it, right, one of the reasons would have all this brain drain even in the healthcare sector. Why? Because we're putting a lot of pressure on the public health sector, and we're running it like NGOs where people are not getting paid what they're worth, and they have to move ahead, right, and go find places where they can be paid what they're worth, right? So the obvious answer has to be that we collaborate together, where the government can act both as an enabler and regulators, just to ensure that we have, at the end of the day, we're working towards the same goal. I think it's actually not a question of either or. It is an and question, right, where every party, both parties need to sit together and say, how can we do it? We are a huge population. Nobody can do it alone. That collaboration is so super important. I mean, at Healthtracka, we do at-home lab testing. We don't own the labs, right? We work with accredited labs. But we can't even work with just any labs. We have to work with government-accredited labs, because at the end of the day, the outcome is what is important. I want everyone who gets a result from Healthtracka to be able to go anywhere in the world and say, this is legit, right? This is true. You can't contest this because it's government-accredited and all of that. So it has to be a collaboration. Absolutely.
So collaboration has it. The specialists have spoken. Who am I? So before we move on, if you have any questions, please prepare your mind to ask. For those that are online, please drop your questions. We'll find time to answer some of them. So finally, to the last part of this session. So there's the conversation around personal medicine that has gotten into Africa, right? It's not a new concept. But now in Africa, you can look at your DNA and fix something you don't want your children to inherit from you. Like you are trying to speak into your future and fix it before you get there. Kind of medicine. That is personal medicine. So there's this conversation around the ethics of it. Maybe it is morally right. Why? Why don't you leave everything to the hand of God? Why don't you allow your children, they will have their own strengths, they will have their own weaknesses. Let them, you can't make them perfect. Those are conversations around the ethics, like morality of personal medicine. So in few points, like shortly, I want you, each of you, to let us know what your stand is with personal medicine.
Will I go first again? So I think that I take the viewpoint that Africa is different and special. So I mean, I've been privileged to work across 3 other continents outside Africa, and the problems they have are very peculiar to them and are very different. And I think sometimes we like to take wholesale what is happening elsewhere without considering our own unique circumstances. And so when people talk about ethics, for instance, I am more interested in access, right? And so in other jurisdictions, they are happy to sacrifice, say, some access challenges or access for ethics because they have a lot of access. We are at a point where we really are struggling. And so if we can get, for instance, personalized genomic medicine that will deliver, low-cost treatments for sickle cell, for instance, and the only thing we need is to be able to get everybody that's got sickle cells data into one singular place, is it a worthy trade-off to make? Maybe it is. I don't think that we should necessarily take the standards that other places have and apply them here simply because our own realities are different. We need to be alive to be able to even have some of these discussions, and we are at the stage where we are not even able to have access to kind of basic treatments. Problems are very different, exactly. So I'd be very careful in these conversations and think that our realities are different. Even on a day-to-day basis, the way a lot of Africans look at data is very different. We aren't as protective of data. We think of ourselves in a community, right, where we are able to share things. So even that, I think, is different and will help us to navigate how we kind of go forward with the ethics of all of this.
Okay, so one of the ventures we have in Advantage Health Africa is called My Labs. Very similar in model to what you have at Healthtracka, and we'll come to you at home to take your samples. But we're beginning to see that it's better for us to play in a niche area. One of the niche areas lends itself to personal medicine. Now, in the US, as I understand, every child that is born, a sample is taken from that child within the first 7 days and is sent to a lab. Each state in the US has that lab. You don't hear from them unless there is a problem with that child. And what happens is that they're able to do a battery of tests, almost 32 or more tests, to see if the child is prone to cancer or has some hormonal deficiency or whatever. And if you know what medicine is about, the earlier you detect conditions, the better the prognosis, because you can then address it early and most likely will not degenerate. What we have in Africa is that our health-seeking behavior makes us seek health too late and we have needless deaths. And mortality is just at a ridiculous rate. If we promote more of these tests, these checks, where there's a database of your results sitting there and useful for you as you grow older, we would have better health outcomes. But that conversation is still further down the line because we're still grappling with millions of people dying from diarrhea, malaria, highly preventable conditions. But it is necessary. It's just that it's a niche market and we need to fund it properly. We need to promote it properly, and then let us also deal with the very immediate, terrifying ones.
Yes, Ifeoluwa.
Thank you. This question actually reminds me, or this topic reminds me of the famous, or at least publicly talked about matter of, I think it was Angelina Jolie, who had to do the BRCA test, right, and was able to detect that she had a 50-50 chance of, having breast cancer. And of course, she didn't want to take the chance and removed the breast tissues. So I remember as well that my earlier days working in diagnostics, the particular diagnostic company I was working with actually had, some of those as well. Just recently, one of the partner labs that we have actually just launched a test that could determine, at 10 weeks of pregnancy, determine any deformity in the baby at 10 weeks, right? So I would say that personalized medicine is early in Africa, to be honest, right? As she said, our problems are way more than the Western world. But I actually also see that acceleration happening, and sometimes for some of the target audience in terms of the people in Nigeria, there will be some people who can begin to look at that, right? Because again, in terms of the Maslow's hierarchy of needs, you're past the food, that part of where you're wondering what to eat tomorrow, right? So now you're at the point where you can look at your future and say, how can I make it better? So yeah, I think that it would gradually increase that awareness and that opportunity, but I would say it's still early, right?
Yes. So it's too early. Our problems are still our problems. Personal medicine doesn't seem like it, but we are getting there. Thank you very much, Neto, Abimbola, and Ifeoluwa. If Victor will give me a chance to take one question from the audience, we will. If not, we will leave here for him. One question. Thank you very much, Victor. So does anyone have any question you want to ask our audience? Yes, that will be it. And we'll take it very quickly.
Oh, thank you. I'm Blessed Ola Saint from Empower Africa Project. Now, my question is to Abimbola and Ifeoluwa, please. This is important, and I want to know, we mentioned collaboration. Now, we know that we have to work with government, but for grassroots and the information dissemination, health education, and digital education, what are the steps you are taking, or your focus is also to the 2.5% of the 200 million Nigerians, or is your project basically for Nigeria? And are you ready to work with enablers for information dissemination, digital adoption? Thank you.
Okay, I picked a part about collaboration. I think one of the unique selling points we have was the early drive to aggregate pharmacies. And then we quickly aggregated in 2018 almost 1,000 pharmacies, just for the fact that we needed to address needs across Nigeria. And some are in as far-flung as Jigawa, as Sokoto, and Yobe. But what you must understand is that it's a transition. People are not used to collaborating. So you must, first of all, increase the trust index. You must trust that we will work together and we will not circumvent ourselves nor compete for the same thing. Rather, we will collaborate and co-compete. So we still have to build trust, and it takes years. We need enablers, so definitely. In an ecosystem, we need enablers. We need to see as many of them as exist. I was speaking to someone called Peace over there, and he is in debt tech. With his debt tech solution, I might venture more into health financing, knowing that I can pass on the bad eggs over to him and he'll do something. Then we can work hand in hand. We need more of that, and that's when collaboration can thrive.
Thank you very much.
Education, yeah. I mentioned that earlier. Education is such a big part of what we're doing. Again, we're banking on the consumer trends and the shift in behavior, which it's definitely not across board. But what is also clear is that this is our time, this is our moment. That education is actually happening right now, right? We have the likes of, I think, Lafayette, for example, who does USSD. That means with just a code, you can get access to telemedicine and all of that. And all that collaboration is happening. So for example, at Healthtracka, one of the things we do, we're currently doing, is we're collaborating even with labs and hospitals in remote places, right? So for example, when we launched in Lagos, everybody asked us, why Ibadan? Like, Ibadan is so close to Lagos, but has half, maybe even a quarter of the infrastructure that Lagos has, right? And then there are people living there. We have our parents, you know, living in Ibadan, or even just older people who actually need type of services that we're offering, right? So I would say that it would be gradual, but it is happening. And a lot of education needs to happen, which is also already happening. And we would see a lot of that, you know, as we go on. But the key bit about that is the collaboration. Because if Healthtracka is going to go around, you know, the country, we're not going to do it alone. We're going to have to be able to work, especially if we want to do it at scale and do it very fast. We need to work with other people who are in those locations to ensure that we can reach them.
Thank you very much, Ife. Please give them a round of applause, please. And that is the end of this session. Picture, please stay together for a group photo.